Hey everyone, welcome back to our EMT review, episode 8. In the previous video, we gave an intro to diabetes and we discussed type 1 and type 2 diabetes. In this video, we're going to discuss diabetic emergencies. Well, the glucose levels can either go up, hyperglycemia, or go too low, hypoglycemia. So as we mentioned previously, the glucose levels are balanced in the body. Roughly, it's somewhere between 80 and 120 milligrams per deciliter. When fasting, it can be even lower, 70 to 110 or even 60 to 100. However, for an emergency, we'll see there's a bit of a bigger range. Now, I want to start off with hyperglycemia and hyperglycemic emergency. So now, although technically glucose levels over 140 or so might be considered some degree of hyperglycemia, there's certainly not going to be any hyperglycemic emergency. In fact, the body doesn't even begin urinating out the excess glucose until it hits about 180 milligrams per deciliter, at which point the body's trying to get rid of it, starts urinating it out, which results in, polyuria, excessive urination, and of course causes excessive thirst, polydipsia. Now, this causes dehydration as well because the body loses lots of fluids and electrolytes, resulting in signs of dehydration. So you'll have dry mouth and so on and so forth. And in addition, because of this hyperosmolarity of the blood, it's going to cause higher viscosity or greater viscosity of the blood, resulting in poor perfusion and blood flow, resulting, of course, in the risk of clotting, but also you'll find sometimes tingling in the extremities over long periods of time, actually swelling in the lower legs, poor wound healing, and so on, blurred vision, right? These are symptoms that are going to develop over time. Another symptom that you'll likely find is polyphagia, hunger, because the cells aren't getting adequate amounts of energy, and therefore it makes the body feel hungry. With DKA, diabetic ketoacidosis, which is more likely in patients with type 1 diabetes, where the cells are not getting any glucose, as a result, the cells start burning fatty acids, resulting in high lactic acid and ketones in the blood. This is going to cause what's known as it's going to cause ketoacidosis, which results in that fruity acetone smell on the breath. And at a certain point, the body tries to get rid of this high acid and results in what's known as Kussmaul breathing, which is rapid deep breathing, similar to hyperventilation. It's a defense mechanism of the body trying to get rid of the excess acid. In this case, it's actually not a good idea to slow down their breathing like we would do with hyperventilation syndrome. Now, the glucose levels in patients with someone suffering from a hyperglycemic emergency are going to be very high, either like over 350 with DKA or over 600 with HHNS, hyperosmolar, hyperglycemic, non-ketotic syndrome, which is more common in patients with type 2 diabetes, where since the cells are getting some glucose, they're less likely to have the lactic acid and the symptoms resulting in the ketoacidosis, hence known as non-ketotic syndrome, hyperosmolar hypoglycemic non-ketotic syndrome. And you'll see very high glucose levels, like over 600. Now, the skin color in patients with hyperglycemia is going to be flushed and dry. Now, the symptoms are going to be developing gradually over days. They'll start, developing the weakness and the thirst and all these symptoms that we mentioned, and gradually getting worse until eventually, if it's not dealt with, they may go into a state of coma. Well, diabetic coma, certainly with DKA, but with HHNS, it can happen as well. They can suffer severe dehydration and drop in the blood pressure and even signs of hypovolemic shock eventually. Now, what is the treatment for someone with HHNS, HHNS or DKA for that matter, with severe hyperglycemia? So now, the definitive treatment ultimately is going to be IV solution, insulin, and the replacement of electrolytes. Now, most of this is not going to be done in the emergency setting, certainly not by BLS providers. In Israel, where BLS providers can administer IV fluids, it would be very reasonable to consider administering IV. Otherwise, you're just going to manage and monitor their ABCs until you get to the hospital. If there's any immediate threat to their ABCs, of course, you're going to call for ALS. And if you're in an area, and if you're in any place where BLS cannot give IV solution, it would be a good idea perhaps to call for ALS, where they can do that en route to the hospital. And that's always going to be the first line of treatment. Never recommend that someone take their, in situations of severe hyperglycemia, never recommend that they take their insulin, because rapid drop in the glucose levels can actually lead to brain swelling, cerebral edema. Therefore, it should be done in a hospital setting where it can be monitored and lowered gradually. We're going to stop here for this video. In the next video, we'll discuss hypoglycemia. If you're watching this on YouTube, like the video and subscribe so that you'll get an indication when the next video comes in. Have a great day.